Welcome back to AM Northwest. Each year, more than 500,000 people are diagnosed with heart failure. It is a scary diagnosis, but new treatments show great promise. Here to share more, please welcome Providence Heart Institute cardiologist Jacob Abraham and his patient Roger Tolliver. Good to have you both with us.
Thanks for letting me be here.
You both look great, by the way, but let me start with you, doctor. What is heart failure exactly?
Well, just like there are different types of cancer, there are different types of heart failure. But in general, what they all have in common is the fact that the heart pumps an inadequate amount of blood to the body to meet its needs.
And what causes that?
Lots of different causes. Some of the most common causes are heart attack, certain types of drugs or other chemicals that damage the heart, valvular problems, arrhythmias, viral infections, all sorts of causes.
Roger, you've been through a lot.
Yes,
so let's talk about your journey. What happened?
When I was 47, I had a heart attack.
47 is really young.
Yes. I was exercising and I had a heart attack.
Darn that exercise.
I know, I know.
Okay, so then from there, what happened?
Well, I went to the hospital. They couldn't remove the object that was stuck in my heart. And so I went on from there. I lost 25% of my heart. And they said that I would be able to live with that for a while at least. And by the time I got to where I was 2012 when things started to go downhill.
And you were feeling badly?
Oh, terrible.
And so what were doctors saying you were going to have to do?
Well, it was either I was going to have an LVAD or I was going to expire, one or the other.
Okay, so doctor, tell me about it's called a VAD, right?
Correct. So VAD stands for ventricular assist device, and essentially that's a surgically implanted heart pump that assists the heart in pumping blood around the body. And in Roger's case, he was so ill that we didn't think he would be a candidate for a heart transplant in a timely fashion. So we proceeded to implant the LVAD, which gave him many years for him to improve and to recover so that he could eventually go on to get a heart transplant, which he had earlier this year.
You had. And how are you doing now with your heart transplant?
Oh, very well, thank you.
Oh, wow.
Very well.
So how new is the VAD?
Well, LVADs have been around since the early 2000s, but the technology has certainly progressed. The pumps have become smaller, they've become quieter. We were actually reviewing that progress backstage earlier, but now these pumps can sit in the palm of your hand.
And can you be an active person with one of those pumps inside?
Yes, you can. After I had it implanted and recovered from that, I used to go fishing, I used to go hunting and everything else, so I had a real normal life other than the fact that I had to take some machinery with me wherever I went.
That's pretty incredible. What does this allow the patients and the doctors then to do?
Well, it allows us to stabilize patients so that they can go on to get heart transplantation, people who would have been too sick like Roger. But I think as importantly, there are patients who wouldn't be eligible for a heart transplant either because of age or some other medical condition who can now live full active lives like Roger did and live on the LVAD for the remainder of their lives.
And this is done at Providence,
yes,
right?
It is.
And so tell me about some other techniques being used at Providence for heart patients.
Well, our goal is to prevent people from reaching the stage that Roger did. So amongst the therapies that exist are defibrillators, biventricular pacemakers. We are very active in using a small sensor called a CardioMEMS device that's implanted into the arteries of the heart through a small catheter and allows us to monitor a patient's heart failure status and keep them out of the hospital just by making medication adjustments.
So I understand that people over the age of 65 are the #1 folks coming into the hospital with heart issues, right? What can we do to prevent heart disease, to prevent heart attacks, to prevent heart failure? What can we do?
Well, I would say the main things are going to be things that you've heard before. So
don't smoke.
Don't smoke, control blood pressure, treat diabetes, prevent diabetes, exercise, maintain a healthy body weight, avoid excessive alcohol. And then if you develop heart disease, to make sure that you see either a primary care doctor or cardiologist to make sure that those factors are controlled.
Have you been able to reduce the number of hospital admissions, people dealing with heart failure?
Well, unfortunately, because of the success of our treatment for other forms of heart disease, for example, for heart attack, we're seeing more people who survive their initial heart attack but incur heart damage that progresses over time and leads them to develop heart failure. So in some way, we're victims of our own success in treating other forms of heart disease.
Well, Roger, I'm so glad you're doing so well. That is fantastic. Absolutely.
Well, it's been a long journey.
Yeah, well, you look good, so that's great. Thank you both very much. Want to tell folks, if you'd like to find out more, you can contact the Providence Heart Institute, Heart Failure Services, 503-216-1182. We'll put that information for you, of course, on KATU.com. Thank you both very much.
Thank you.
Appreciate it.